My last guest of this hour is Dr. Vivek Murthy, the recently recently appointed 21st U.S. Surgeon General, a role that he's returning to after serving as the 19th Surgeon General during the Obama administration. Dr. Murthy, it's great. So let me just ask you, does your picture go up twice in the hall?
I actually have not thought about that, Steve. That's a good question. I'll have to find out.
We'll get back and we'll do a little segment on the Hill on that. Dr. Murthy, it's great to be with you. Look, I've tried in our conversations this morning to kind of move forward a little bit on the question of where we stand as a nation on mental health. Are we reaching people that we have not traditionally reached? Are there new methods of getting there? I know that this is very, very important to you, and I'd just love to kind of get, if you were to give the State of the Union yourself on mental health in America, where are we?
Well, I'm so glad you raised it, Steve. You and I have spoken about this subject before in years past, and I was deeply concerned about where we were as a country regarding our mental health before the pandemic began. But my concerns have only grown since then, in part because we're seeing rising levels of anxiety and depression across the population during this pandemic, and that was compounding rates that were high before then. There are some places where we've made progress and some areas I think where we have work to do. In terms of progress, I do think we are talking more about mental health as a country. I think more people are sharing what they're going through. That is extraordinarily important because the stigma around mental health really prevents people from stepping forward to get help. The other place where I think we have made progress is in actually funding mental health services. And we've certainly funded even more recently SAMHSA, the Substance Abuse and Mental Health Services Administration, with additional funds to provide more community-based mental health services. All of that is good. But here's where my concerns are. My concerns are that we are still not doing enough to meet the extraordinary demand that we have. And what we have to do is, number one, continue to work to the best of our ability to expand access to services. And that means not only mental health care in an independent clinic, but integrated into primary care. We also have to make sure that we are training more mental health providers. And we've got to invest on the prevention side as well, Steve. We have programs that we know work to help reduce depression and anxiety, to help reduce the incidence of a whole host of other conditions like substance use disorders. And these are cost-effective programs that can be implemented in schools, yet we're not investing in those. So I think we have a lot that we can do. And my hope is that we will use this opportunity during COVID, when a spotlight really has been shined on mental health, to really talk more about it, to reduce some of that stigma, and to invest in prevention and treatment.
Well, look, you and I always speak candidly to each other, and I don't know the answer to the question I'm going to ask. So I'm just wondering, after having discussed this issue for so long in the American healthcare system, looking at hospital systems, and I don't want to, the hospital systems that are watching this right now, I don't want to recklessly criticize you either. I know that the incentives around how you provide services, that there are some systems that prioritize mental health, others that are less able to do that. And I'm just wondering whether or not, as we talk about this, and we talk about needing to get something of scale, are the financial incentives, or the economic incentives, or the business design of our healthcare system one that leads people to providing more? Or is it something that you have to do because you're a moral healthcare system and you want to build that in? I have to tell you, I don't believe the incentives are there at a systemic level for mental health to become an obsession of the healthcare. I mean, am I wrong?
Well, Steve, I don't think you're entirely wrong there. I think that there have been efforts to align those financial incentives more. And a couple of them, for example, moving more toward value-based payment models is one movement that in theory should incent health systems to focus more on both physical and mental health and in prevention in both realms. And there was also in 2008 a law passed, also very colloquially referred to as the parity law, which said that insurers have to reimburse for mental health care in parity with how they reimburse for physical health care. But yet we know that is still not adequately implemented, that it's not enforced around the country. So people still to this day are not able to get the kind of mental health care they want, and their systems are not reimbursed in the same ways they are for traditional medical care. So we've got more work to do, absolutely. And I think what we also need to do, Steve, in terms of spurring innovation, is I do think we need to invest on the early side as well in technology and other tools that can help design the kind of tools that people need in their day-to-day lives, as opposed to relying on them solely to see a mental health provider as their sole access to mental health care.
Do you think it's silly? I mean, I don't know if you saw the first conversation I had, a fascinating gentleman with David Klein of Click Therapeutics. And in this, it just made me think of conversations we've had before about loneliness, that in this country, people have a hard time for whatever reason, connecting. And sometimes people are feeling very isolated. They can be in a crowded room and feel isolated. They can be in a community and feel isolated. And we see so much division. I'm just wondering, I've always been skeptical of this, but I'm just wondering if software in the wired world and having somebody saying, hey, did you get up and stretch today? Did you go for a walk? I'm just wondering whether or not it's okay to think that technology might help some of our loneliness problems.
Well, Steve, first of all, you're touching on a subject I think is extraordinarily important. I do think loneliness is a much bigger challenge in our community than people have realized. I think it has profound impacts on our mental health and our physical health, including reducing lifespan, increasing the likelihood of premature death and heart disease, as well as depression and anxiety. But I think it's flown under the radar for a long time, and millions of people have suffered in silence. I think while we need, high quality relationships, all of us in our life, I don't think it's wrong to think that technology can be helpful here. Technology can never substitute entirely for people, but it can be a bridge to offline connection, and it can also provide real community for people who may otherwise be physically isolated in their lives. What matters, though, Steve, what really matters when we use technology is thinking about, can we, in the forums that we engage in, can we authentically be ourselves? Can we show up as who we are? Can we share openly and honestly? Can we be ourselves? And for many people, the answer is no. But this is what I think should be guiding, though, our development of technology. We should be telling entrepreneurs and inspiring a new generation, I believe, of technology entrepreneurs to not just gauge success by how many users you have and how much time people spend on your app, but to gauge success by the quality of interaction that they have, by the relationships that they develop where they can truly show up as themselves. That's how we build connection. That's how we reduce loneliness. It's how we build the kind of social cohesion that will allow us to thrive as a society.
Vivek, I want to ask you about the progress. We've heard from President Biden about the vaccination progress, which frankly has been astounding. Now new goals to reach 70% of every Americans with at least one shot by a certain period of time. But I guess, again, looking at the entire healthcare system, the American Families Plan, the policies that are rolling forward, can you fill in how we as stakeholders in this country are going to see our health terrain shift and change a bit for the better?
Well, it's a good question because there has been so much that has happened, Steve, as you rightly point out, over the last few months. There have been historic investments that have been made in the public health infrastructure of our country to support local departments of public health, to build a public health workforce for the future. There's also been investments in families and in children, investments in, that the president has been pushing for regarding universal pre-K, providing free college and community college for 2 years for everyone, as well as tax credits to support people, especially working parents who may be struggling to care for their kids and also hold down their jobs. And I think what these will ultimately go toward doing is strengthening the foundation of society. What we need all of us, however rich or poor we are, however old or young we are, we all need to know that healthcare will be there for us. We all need to know that basic needs like hunger, like food and shelter will be met. And many of the acts that the president has spoken about are aimed at building and strengthening that foundation. It's very hard to think about what kind of company you want to build, what kind of book you want to write, what kind of music you want to create when you're struggling to figure out where your next meal is going to come from, or if you can actually get healthcare. We can strengthen that foundation for America. We can allow ourselves and future generations to thrive, and that's what we should be aiming to do.
We have a question for you from Samantha. Samantha?
Thank you for the opportunity to ask a question. My name is Samantha Brooks. I am a retiree of the Benjamin Rose Institute on Aging in Northeast Ohio. My question is, I'm interested in how the United States will extend new innovations, offer access, and best practices to lower income and minority populations who have historically received less than optimal care from the medical system. Eliminating disparities must be a part of the conversation, as well as solutions to balancing cost and innovation.
Thank you. Dr. Murthy?
Well, Samantha, first, thank you for that question. You've highlighted what I think is more than a program or an approach, it's a value, which is equity. And we have to ensure, you're absolutely right, not just in the dissemination of innovations, but in the provision of basic healthcare services and public health services, that we are reaching everyone and not just those who are privileged either based on their income or their neighborhoods. And that the only way I think equity becomes a priority is, number one, if we explicitly make it one, if we measure our progress and if we hold ourselves accountable. And part of our challenge historically has been that we haven't measured even how we're doing when it comes to equitable distribution of resources. Even on the vaccination effort, we've had to really push to gather more and more data about race and ethnicity when it comes to who is being vaccinated. We've got to collect that data more rigorously, and then we've got to hold ourselves account to closing gaps when they exist. Because if COVID has taught us anything, it's that we cannot thrive as a society when some of us are suffering. And if in COVID in particular, we know that if infection is spreading in one part of the country, it can spread to any part of the country. And so we've got to take care of everyone. But this is actually true with non-infectious illnesses as well. If part of our country is struggling with high rates of chronic illness, with substance use disorders, with mental illness, and what that means is that we're not as strong as a society. Businesses can't hire the best possible people. Schools aren't being able to support their kids in the best possible way. So equity has got to be a hallmark of how we move forward. We've got to move toward a we versus me approach to health. And I think equity has to be the hallmark of how we do that.
Vivek, I can't end the conversation without recognizing that there are other parts of the world that are in terrible, terrible shape right now. And I imagine that you, like people on our staff here at The Hill, have relatives, extended relatives in India today. I want this not to just be about health in the United States. You have an important role and you're looked to from all places, from many places around the world about insights into about how to get public health and that the connection that we have to what's going on in other nations in the world. Can you just give us a quick snapshot? And I know it's not a rah-rah subject, but what do we need to do to be more understanding, empathetic, and connected to particularly the COVID challenges beyond our borders?
Steve, I'm so glad you asked, because in addition to COVID highlighting the fact that we fundamentally need each other as human beings, it's also highlighted that we are interconnected around the world. And that when COVID flares in one part of the world, that means that more variants develop. That means that all of us ultimately are at risk because those variants can come here. But in a world that has a really interdependent economy, we also know that economic ripples caused by public health flares, in other countries ultimately have an impact on us in the United States. But fundamentally, look, even more important than health and than economy, I think, are our values. As a country, I am proud as an American to say that we have led at many points in our history to take on some of the greatest crises around the world. This is one of those crises that has really turned the world upside down over the last year. And I think what we need is to ensure as a globe that we have equitable access to help. And specifically what that means is that we've got to ensure every country has an adequate supply of low-cost vaccines. Whether we do that through a combination of public sector initiatives and private sector initiatives that together can increase manufacturing capacity, raw materials inputs, and technology transfer. However we do it, we've got to get that done, because we do not get through this unless we get through it as a global community. And if COVID hasn't made that clear, I don't think anything will, but we've got to act on that now. And we have. You see already steps being taken from the United States side to invest in COVAX to help supply the world with vaccines, sending aid to India, designating AstraZeneca supply to go to the rest of the world. And this is just the start, I think, of what you will see in terms of even more global action from the United States. But we've got to lead the world in this effort, because it's only through collective action that we will ultimately turn this pandemic around.
I'm really glad you shared that. It's so important because we are connected. Dr. Vivek Murthy, Surgeon General of the United States, the 19th and the 21st Surgeon General. I know your staff are watching now. I want to know if your picture is going to go up twice in the hall. Thank you so much for joining us today.
I'll make sure I get back to you, Steve.
It's always good to see you, my friend. Thank you.
Good to see you as well. Take care, my friend.